build families and communities, and the role that school-centered mental health plays in that is really equipping families and communities with knowledge and reducing stigma and addressing those barriers to access. Partners of Change brings together folks from all different service industries and looking at how can we best work together to increase the efficiency and outcomes for the children in the systems across the state of Wisconsin.
As credentialed school counselors, we're easily able to intervene and assist many student needs, but in recent years we've seen the nature and the intensity level of student and family issues rising to a level with which we are not as well trained and comfortable to adequately address. So through our partnership, we've had the wonderful support of a family coach and a therapist who's been able to provide us with a great level of extra support to help our students be the most successful they can here at school.
When we send our child over here for after school services, and then we send them over there for mental health services, and we send them another place to be educated, and oh, by the way, the parent is very often somewhere else earning a living, the ability to make sure there's continuity across those various settings is drastically decreased.
For me, for the school to bring in a therapist into the school is just knocking down a huge barrier for so many families. Plus, it just opens up the door for communication. That therapist is in the school. I can't imagine how great that's got to be for a resource for the teacher, a resource for the administrators.
The practitioners are in the school. They don't drop in and drop out. They are available for crisis intervention, so they're there when our children are experiencing their most profound crises and have the greatest need for those services.
What we've seen is an increase in mental health services that our kids may need. And so for years, our guidance counselors really did whatever they can to support the child, but they were limited on how they could support the families. We've broken down the walls from the school and now have expanded into the homes for those kids who really need those services.
Having those services available at our fingertips at the school, and then having the family coordinator come in and meet with the parents as well, it was huge.
Students are learning ways to manage and identify their emotions and stress, and being able to respond in a resilient way, in a healthy way. That means that we're going to have stronger communities. That means that we're going to have less violence. That means that we're going to be more innovative as a society. And so these supports in the school are so important.
To be able to share how powerful this partnership has been is really important to me. With appropriate funding, with support, to be able to offer programs like these in schools across our state, I really believe that the impact could be incredible. Students are only able to be their best selves in their classrooms when they're able to fully commit to their academics. When other needs, when other struggles are at the forefront, mental health issues, they get in the way of them being their most successful from an academic standpoint. Families likewise want to do their best. We all want to do what's best for children, but sometimes there's barriers that make that extremely difficult for a number of different mental health reasons.
Using the family coach approach, the school-centered mental health model is able to really teach parents new skills, new coping approaches, and different tools and tricks and resources, and connect them with additional care, additional resources, and additional strategies that best support students in their home setting, and also supporting the other folks in the home, including siblings or other family members that are important to that child's life.
We need to have that funding source, so therapists, so the schools, the school resource officers has got the resources to be able to support the whole family. The schools are so vitally important to this because they connect everything together. They are able to connect resources and the parents together.
There needs to be handshakes between the families and between the schools, because they're all focused at the end of the day in doing the best job for the child.
We're able to serve families as a team and to collaborate, to brainstorm as one group, focusing on the challenges in addition to the strengths and the progress that students are making, with having a better understanding of triggers and root causes of some of the behaviors we're seeing in the classroom, we're now better able to understand and respond in a more trauma-informed way so that the child can be as successful as possible in the classroom.
It's a wonderful school-based intervention. It doesn't exist in most schools, and where it does exist, it's not able to be implemented to the best capacity possible that supports youth in schools.
These are issues that we need to take serious. Our legislators need to understand that this is a serious issue. I think mental health is one of those things that we've ignored for many years, and we've refused to acknowledge that it exists. I think mental health is at the forefront. And that's first and foremost the most important thing we can provide a child. Whether you provide a beautiful library like this full of books, pencils, papers, math books, or whatever the case you have, that means nothing to a child who's suffering from mental illness or having struggles at home. If we don't take care of those things, then all we're doing is just like a hamster sitting on a wheel, spinning and spinning and spinning, and why nothing is being done. We need to acknowledge that mental health is a real issue in this country, it's a real issue in our state, and that until we start addressing that issue first and foremost, we're not going to move the needle.
And what the Partners of Change and the school-centered mental health model does, it says this is what's possible. It is possible for us to wrap children and communities and their families and the teachers in this understanding and provide resources and tools and skills and attitudes and knowledge around what mental health could be across the state of Wisconsin.